When you're structuring your narrative, there's going to be three components. And I've made a little drawing here because I'm a bit of a dork. So first of all, you want to talk about what triggered your interest in medicine. Then you want to talk about how you explored that interest. So what volunteer activities, what research did you do, what doctors did you talk to, anything along those lines. And then finally, you're going to talk about what really solidified your decision. How did you decide to pursue medicine? So that's really important as well. That could be a patient experience or even an experience outside the hospital, outside the clinic, outside the research realm. The second important thing you'll notice on this chart is this little arrow off to the side. This indicates time. So you're going to be taking the interviewers through your decision-making process as to how you decide to pursue medicine in a chronological narrative. So step by step, what sparked your interest, what continued your interest along the way, and how you explored that, and what finally solidified your decision.